Hi, I'm Mark Davidson. Getting and staying healthy is a journey most Americans are constantly trying to achieve to live longer lives. As a former collegiate athlete and now life coach, I value health and wellness. Therefore, I see my primary care provider yearly for well checkups. However, it is just as important to see a healthcare provider when you're not feeling well. Currently, more than 40 million Americans are uninsured, and many people do not know their options to access their medical care. Throughout the nation, most people can identify when they go to a doctor's office. They may see an osteopath, a nurse practitioner, a physician's assistant, or a medical doctor. But what about when your nurse practitioner is a doctor? Some nurse practitioners have gone on to get a degree as a doctor of nursing practice. So what does it mean when your nurse is a doctor? Let's take a quick look at one of those settings.
So are we ready today? How are you feeling?
The Doctorate of Nursing Practice is the highest degree you can earn in nursing along with the PhD, and you can find Doctors of Nursing Practice in all 50 states. To become a DNP, or Doctorate of Nursing Practice, requires the usual nurse practitioner training and then extended courses that go to a higher level of knowledge that focuses on assisting patients to navigate the increasingly complex healthcare system, understanding and learning to influence healthcare policy, providing leadership to be an advocate for patients and families, understanding the latest and best treatment options based on scientific evidence, learning to use computer technology to improve patient care, and developing an understanding of the role culture and ethnicity plays in healthcare and healthcare outcomes. All of these skills are important in order to reach the healthcare goals of our nation and of each of us individually. The American Association of College of Nursing recommends a transition to this Doctorate of Nursing Practice degree as an entry level into the nurse practitioner role, allowing your nurse practitioner to become your doctor.
Understanding what the Doctorate of Nursing Practice degree is requires us as practitioners to educate the reasons as to why this particular degree was developed, and to certainly bring an awareness to our patients, the community, and certainly other healthcare professionals who may not necessarily know our scope of practice, or basically what we do.
My interest for this degree came out of a passion for working with patients in a family practice clinical setting. With the economic challenges that the United States has encountered over the past years, when many people had to transition into other fields because of a loss of job, the healthcare industry, on the other hand, has and continues to experience a critical shortage of healthcare providers. As a healthcare provider, we have a responsibility to provide quality care and improve patient outcomes within the population we serve. Therefore, this requires advanced scientific knowledge in an ever-changing yet complex healthcare system in the 21st century.
So the real question is, why now?
Why now? Well, for more than 50 years, nurse practitioners have been practicing high-quality care to patients of all ages and socioeconomic backgrounds. Many studies show the quality of care provided by nurse practitioners and the patient satisfaction that accompanies it. On October 5, 2010, the Institute of Medicine released the Future of Nursing report. In this report, a key point was addressed that directly affects the scope of practice for DNPs. Simply, it stated to remove the scope of practice barriers that inhibit nurse practitioners from practicing to the full extent of their education and training. Soon after this, the Florida Federal Trade Commission office released a document urging legislature to do much the same. So you ask, why now? Well, because healthcare demands a change. The Healthcare Reform Act is calling for a new era led by nurse practitioners, and simply because Americans deserve the best healthcare provider that places them first. DNPs will help to move healthcare forward for a better tomorrow. DNPs are the now.
When choosing a healthcare provider for you and your family, it is important that you know all of the options available to you. With the shortage of healthcare providers, who will meet your healthcare needs? Among options for access to a healthcare provider will include the Doctorate of Nursing Practice, known as DNP, to help close the gap for Americans.